I still wake up in a cold sweat sometimes, months after the verdict, seeing the horrified look on his face. My father's face when I first told him. How do you tell the man who taught you how to tie your shoes, who held your hand when you were 5 and terrified of the dark, that the surgeon he trusted with his life had taken his wrong leg? It sounds like a joke, a dark, ridiculous movie plot, but it was my reality, my family's nightmare, played out in the stark, terrifying white of a hospital room in a small town in Austria. Was I wrong to fight them? To push the medical board and the courts until they were forced to look at the staggering, unbelievable negligence that had robbed my father of his final years of independence? Tell me, honestly, if you would have done the same thing. I mean, my father, Josef, he was 82 years old, a man of simple pleasures. He loved his garden, his daily walk to the local bakery for a Kaisersemmel, and his evening glass of Grüner Veltliner while watching the sunset over the hills of Freistadt. He wasn't frail, he was just old. The problem started subtly, as these things often do. It was his left leg, the knee mainly, that had been causing him trouble for about a year. It was a chronic issue, peripheral artery disease, which had severely restricted the blood flow. His toes were getting cold and the pain, especially at night, was becoming unbearable. We had tried everything conservative, medication, physical therapy, but the specialists all agreed amputation was the final, unavoidable step to preserve his quality of life and prevent gangrene from setting in. It was a terrifying decision, but one we made together as a family. My father, with his typical stoicism, just sighed and said, "Well, better one leg gone than the whole man." The plan was clear. The left lower leg, below the knee, was to be removed. The hospital was the Klinikum Freistadt, a reputable regional clinic. The surgeon, a woman whose name I won't use entirely out of a respect for the court's proceedings, but let's call her Dr. Schmidt, was introduced as an experienced specialist. I met her once briefly before the surgery. She was professional, maybe a little rushed, but she reassured me that it was a routine procedure. I remember standing by my father's bedside the morning of the operation. He was calm. "I'll be able to drive my tractor again," he joked, even though his tractor driving days were long over. I kissed his forehead and said, "You just rest, Papa. I'll be here when you wake up." That was around 7 a.m. The surgery was scheduled for 8 a.m. I went to the waiting room, pacing, replaying the doctor's words in my head. Routine, experienced, necessary. The clock crawled. Finally, around 11:30 a.m., Dr. Schmidt came out. She looked tired, her surgical mask pulled down, but she smiled, or at least I thought she did. "The surgery was successful," she said. "Mr. Novak is in recovery. We'll monitor him closely." I felt a wash of relief so profound it nearly brought me to my knees. The worst was over, or so I thought. I was allowed to see him late that afternoon. He was groggy, drifting in and out of consciousness. The first thing I noticed was the massive, thick bandaging on his right leg, not his left, his right. My blood turned to ice. I thought, no, that's not right. Maybe they bandage both for support, for symmetry. I frantically waved down the nurse. Excuse me. There's a mistake. The surgery was on his left leg. Why is the right one bandaged?" The nurse, a kind, older woman, looked confused, then checked his chart, and then her face went white. She mumbled something about calling the senior nurse and rushed out. The next hour was a blur of frantic activity, hushed voices outside the room, and the horrifying realization dawning on my father's face as he finally became fully lucid. When Dr. Schmidt came back in, she didn't look tired anymore. She looked shattered. Her eyes were red, and her voice was a thin, trembling whisper. She confirmed it. In a moment of unbelievable, catastrophic error, the team had prepared the wrong limb. The pre-surgical checklist, the marking of the limb, the final confirmation, all of it had failed. She had amputated my father's healthy, completely functional right lower leg instead of the diseased, painful left one. I didn't scream. I didn't cry. I just stood there, staring at the bandaged stump where his right leg used to be, and then at his left leg still visibly dark and cold, still agonizingly there. The man had lost his healthy leg and he still had to lose the diseased one. He was facing a bilateral amputation because of pure, unbelievable negligence. My father looked at me and his eyes, usually full of a gentle, quiet humor, were filled with a raw, agonizing despair. "My tractor," he whispered, a single tear tracing a path down his cheek. "I won't even be able to push a wheelchair." What followed was an immediate second surgery. They had to take the left leg too. It was medically necessary, and now psychologically it was the only way to move forward. The next few weeks were a living hell. My father's recovery was complicated. He was angry, heartbroken, and deeply depressed. He had gone from a man with one serious health issue to a double amputee, completely reliant on round-the-clock care. And I was consumed by a cold, righteous fury. The hospital launched an immediate internal investigation. Dr. Schmidt offered an emotional, tearful apology to me, but she couldn't even look my father in the eye. She admitted it was an organizational failure and a tragic human error. But that wasn't good enough. An error is a typo. This was an irreversible, life-altering atrocity. I hired a lawyer immediately. I wasn't after a massive payout, though my father's care costs would be enormous. I was after accountability. I wanted the world to know what had happened in that sterile operating theater, and why the protocols designed to prevent this exact type of error had failed so spectacularly. We filed a civil suit against the hospital and the surgeon, and the case quickly moved into the criminal realm, as Austrian law dictates that gross negligence causing serious bodily harm must be investigated by the prosecutor's office. The pressure was immense. The media got hold of the story, and suddenly my private family tragedy was headline news across Austria and Germany. Reporters camped outside my house, and I had to shield my father from the worst of the attention. The hospital's defense team tried to paint it as an isolated incident, a perfect storm of bad luck and human fatigue. They talked about the complexity of the preoperative process and tried to minimize the surgeon's personal responsibility, suggesting the team failed as a whole. And honestly, I felt a flicker of sympathy for Dr. Schmidt. She hadn't woken up that morning intending to ruin a man's life, but sympathy couldn't give my father his leg back, and it couldn't give him back the independence that had been so cruelly stolen. The prosecution's case hinged on the fact that the correct leg had been clearly marked in the patient's chart, and that the surgeon, as the lead professional, was the ultimate and final check in a safety process known as the timeout procedure. She had failed to visually confirm the patient's identity and the correct surgical site against the paperwork before making the first incision. It was a failure of the most basic, fundamental surgical safety protocol. So that was the situation I was in. I was watching my father, a man who had worked his whole life and never asked for anything, now utterly broken and facing a future of complete dependency, all because a surgeon skipped a step on a checklist. The medical system that was supposed to save him had irrevocably ruined his final years. Before I tell you about the trial and the stunning verdict that followed, I want you to pause right now and comment below. If this were your father, your parent, what would you have done? Would you have accepted the hospital's apology and settlement offer? Or would you have done what I did and pushed for criminal charges and full public accountability, knowing the toll it would take on your family and the surgeon? I genuinely want to know what you would have done in my shoes. The trial was harrowing. My father couldn't attend most of it. His health simply wouldn't allow it. I sat in the courtroom every single day listening to the dry, technical language of medical malpractice used to describe the utter devastation of my family's life. Dr. Schmidt was there, looking diminished and terrified. When she took the stand, she broke down, confirming the sequence of events and admitting to the failure to properly verify the surgical site. She talked about the pressure, the volume of surgeries, and her profound regret. The courtroom was silent. I almost felt the crowd start to shift their sympathy toward her. But then I looked down at the pictures I had brought. Pictures of my father working in his garden, standing proudly next to his sunflowers, his two strong legs firmly planted on the earth. I focused on the truth. Her pressure was a bad day at work. My father's consequence was the rest of his life. The prosecutor, sharp and relentless, pressed the point. Every patient deserves the full, undivided attention and adherence to safety protocols, regardless of a surgeon's workload. The evidence was irrefutable. The surgery was on the right leg. It should have been the left. The question for the court was not if the error occurred, but whether it constituted criminal negligence. After a tense few days, the judge delivered the verdict. The judge presiding over the Linz Regional Court found Dr. Schmidt guilty of grievous bodily harm through gross negligence. The courtroom gasped. While the civil suit for damages was still pending, this criminal conviction was the stunning verdict I was fighting for. The punishment was relatively mild in a punitive sense. A conditional sentence of 4 months imprisonment and a fine of €2,250. It seemed small, but the true consequence was professional. She was barred from practicing medicine. The judge, in his closing remarks, emphasized that the sentence was intended to send a clear message. Safety procedures in a hospital are not optional guidelines. They are absolute mandates, and failure to follow them will result in personal, criminal accountability. The aftermath has been complicated. Dr. Schmidt lost her career, which is a tragedy of its own making, but I believe it was the right decision. My father received a substantial settlement in the civil case, enough to pay for his extensive rehabilitation, specialized prosthetics, and the complete redesign of his home for accessibility. But money is just paper. It doesn't heal a broken spirit. He is learning to navigate his new reality. He has good days and bad days. We are working with therapists, and I'm dedicating all my time to his care. He can now use motorized prosthetics and a custom wheelchair, and he recently managed to spend an hour in his garden, just sitting, supervising the planting. He won't drive his tractor again, but we talk about teaching him to use a remote-controlled drone to fly over the fields instead. It's a small, hard-fought victory. The court's stunning verdict gave my father and me one thing that money never could: validation. It proved that his suffering was not just an unfortunate side effect of a flawed system, but a crime committed by a human being who failed in her ultimate duty of care. It brought a measure of closure, a final acknowledgement that what happened was unacceptable and criminal. It was a fight I had to win, not for revenge, but for the principle. This whole experience taught me that when you are up against a massive, faceless institution like a hospital, you cannot let your voice be silenced. The moment you feel that chilling fear, that deep sense of wrongness, you have to push, to scream, to use every tool available to demand justice. Because if you don't fight for the person you love, who will? My father's life is forever changed. But we are moving forward one day at a time, supported by the truth that the justice system, though slow and painful, ultimately sided with the elderly man who lost the wrong leg. Like this video if you were on my side in this incredibly difficult fight. Subscribe to my channel for more deeply personal and shocking true stories just like this one. Because the world is full of them, and we need to talk about them. And please share your final honest thoughts on this whole mess in the comment section below. Do you think the punishment fit the crime, or was the outcome too harsh on the surgeon? I'll see you all in the next story.